Dr. Shapiro, what are the treatment options available for patients with congenital plasminogen deficiency with airway obstruction and respiratory distress? And would it differ from treatment for patients with congenital plasminogen deficiency alone?
Well, that's a difficult question because at this point in time, there are no FDA approved medications specifically for treatment of patients with plasminogen deficiency. What we do for patients with coagulation disorders, deficiencies, is to replace that clotting factor to a level that would be considered hemostatic or would suppress their clinical symptoms. At this point in time, since nothing is specifically licensed, we've been relegated to use fresh frozen plasma in these patients. Unfortunately, this is not a good treatment option, despite the fact that it is the best we have at this point in time, because the concentration of plasminogen in fresh frozen plasma is quite dilute. Therefore, you need recurrent infusions over a prolonged period of time to achieve a level that could cause regression of symptoms and improvement in the patient's clinical status. Therefore, the use of this agent, the IV plasminogen concentrate, which is the glue form and has a longer half-life, really is a very important therapeutic modality that could potentially come to market for the treatment of these patients. This medication treats the systemic manifestations of the disease in all of the organ systems, and therefore can be used for patients with respiratory involvement with plasminogen deficiency. In Dr. Nakar's, in my experience, it is a very effective therapy for rapid treatment and improvement in these patients' clinical status, as opposed to anything else that we do for these patients, including other supportive measures which have often been used, including steroids, bronchodilators, etc. These are all just adjunctive medications as far as we're concerned, and the best option really is a systemic form of a specific replacement therapy that's in a concentrated form to allow a rapid achievement of hemostatic levels.